Hi, my name is Greg Fell, I'm Director of Public Health. This is an update as of May the 4th. So epidemiology, where we are, vaccines, and then short-term and medium-term outlook. Firstly, Epi, R for England is 0.8 to 1.1, R for Yorkshire is 0.8 to 1. So the epidemic is shrinking slowly or flat. 7-day rates, we are less than 50. That has come down massively over the last few weeks. It's now flat, and I think that's the unpicking of the lockdown, because we're out and about more, therefore there will be a bit more infection. There'll be an inevitable increase going forward. Over 60s and over 50s rate is still going down. That's definitively the impact of the vaccination programme. The 4 government tests, vaccine numbers, vaccine impact, pressure on the NHS and variants of concern are definitively met. There's no two ways about that. Uncertain how that will play out in the medium term. I'm confident that Sheffield will continue to strike the right balance between keeping people safe, keeping transmission low, and kickstarting Sheffield. Biggest risks looking forward: variants, people being balanced and acting safely, but also people becoming blasé, and vaccine confidence and coverage, particularly in younger adults, will be an issue. So vaccination coverage is really high in the over 50s. Thank you to all of you who've chosen to be vaccinated, and thank you to all of the efforts of many people who've enabled this, because that hasn't happened by magic. Next up, vaccination wise, is younger adults. So we'll be vaccinating people below the age of 50, below the age of 40, and then eventually from 20 plus. It's really important that we all take up the offer when we're offered. The importance of vaccination in younger adults is it keeps transmission low, therefore enables us to keep Sheffield open and to keep Sheffield going. On the medium term, people ask me about what will happen in the future. There'll inevitably be an increase in rates as we shift from step 2 to step 3 of the roadmap, and probably another increase in rates as we shift from step 3 to step 4. We will focus on what keeps transmission low, because we want to keep Sheffield open. Nobody wants to go back to any form of lockdown. So we should all focus on, just because I can doesn't mean I should. Our 7-day rate is double the national average. So nationally, the rates are well below 20 per 100,000. Our rates hover about 40-45 per 100,000. Can take off. Younger adults will not be vaccinated en masse soon, and the virus still can harm younger adults, particularly if they're infected in massive numbers. So there's always potential for a significant takeoff. So we remain cautious about that. When we locked down, our coverage of the B117 or the Kent variant was about 50%. Now we're opening up, coverage is 100%. So we'll see the full impact of the Kent variant. There's no two ways about that. So I think we're going to see a rise in rates in the under 45s and the under 35s. Quite a key question for all of us is if you don't need to be in work, you don't need to be in work. If I'm in work, and we will see workplace outbreaks, that will become an issue for business continuity for all of our workplaces. Post step 4, we will still be focusing on getting Sheffield open, but the basic strategy will remain keeping people safe, protecting the vulnerable, and getting Sheffield open. There's still a lot of susceptible individuals out there. Some of that is to do with people not being vaccinated. Some of that is to do with the vaccine not being 100% effective. It's very effective, but it's not 100% effective. So we'll be doing a lot of work over the coming months to look at to learning to live with and adapting to COVID.